Hi everyone, this is Dr. Bolad, certified physician in cardiology, interventional cardiology, and internal medicine. Today, I will be talking to you about heart failure secondary to the coronavirus infection. Heart complications secondary to the coronaviruses are well recognized from the previous historical epidemics, and heart complications are a significant factor in deaths from the coronavirus. The heart complications, as I mentioned in a previous video, include heart failure secondary to inflammation of the muscle of the heart, a condition that we term medically as myocarditis. Secondly, it leads to heart attacks, which also lead to heart failure. And thirdly, there are irregularities of the heart beating, which can occur secondary to heart failure and heart attacks. The commonest complication of the COVID-19 coronavirus is inflammation of the muscle of the heart, leading to heart failure. The following table shows the heart complications from the recent coronavirus epidemics, namely the SARS epidemic of 2002, the MERS epidemic of 2012, and the current coronavirus pandemic of 2019, the COVID-19 pandemic. I highlighted the COVID-19 pandemic and the heart complications. As you can see in the large study by Wang and his colleagues, the occurrence of acute heart injury, significant drop in blood pressure, and irregularity of the heart beating secondary to the heart injury was quite high. Reports from COVID-19 cases show that multiple patients who already have underlying pre-existing medical conditions are at a higher rate for heart complications and are at a higher risk of death. Up to 50% of patients hospitalized with coronavirus infection had chronic medical illnesses, of whom 40% had heart and vascular disease. What is the clinical significance of heart injury and heart failure in COVID-19 infection? We generally know that patients with heart injury and heart failure have reduced survival compared to the normal population. The COVID-19 virus can cause heart damage and heart failure very quickly in a matter of days. Reports from Wuhan, China, where the COVID-19 pandemic started, shows that patients with heart injury are more likely to die acutely. In a recent study of 671 patients with severe COVID-19 infection admitted to hospital between January 1st through February 23rd of 2020, patients were more likely to get heart injury if they were older, had high blood pressure, had heart disease or chronic kidney disease, chronic lung disease, and elevated markers of inflammation. A total of 62 patients died, which accounted to about 9% of the patients. Of the patients who died, 30% had heart injury and 19% had heart failure. Can patients without coronavirus infection during the pandemic get heart damage? The coronavirus pandemic has been associated with social, psychological, economic stresses. Acute heart failure is known to occur in stressful situations in healthy individuals. The heart usually recovers in a short period of time after resolution of the stress. This type of heart injury is labeled as Takotsubo syndrome, and it's also known as the broken heart syndrome. This is how it is seen during cardiac catheterization. The image on the left side shows a dilated heart. The image on the right side shows that during contraction, the majority of the heart does not contract and remains dilated, but the basal part of the heart remains functional and contracts. In a recent study published in the medical journal JAMA, investigators studied over 1,900 patients with heart attacks to compare patients presenting during the COVID-19 pandemic with patients presenting across 4 timelines prior to the pandemic. They found out that there is an increased incidence of 7.8% of stress cardiomyopathy during the COVID-19 pandemic during the period March and April of 2020 compared with pre-pandemic incidences that ranged from 1.5 to 1.8%. Therefore, to answer our question, yes, heart failure can occur in normal individuals without the coronavirus infection during the pandemic, and it is related to the different stressors that lots of individuals are experiencing during this pandemic period. Usually, the outcome is good and the heart recovers to normal function within a short period of time. Does the heart damage from the coronavirus persist on the long term? As the coronavirus COVID-19 virus is a new novel virus, we do not have information relating to the long-term effects of the virus on the heart. However, we do have information which gives some idea about the long-term effects on of COVID-19 on the heart. The data include: number 1, chest infection and pneumonia are linked to increased risk of heart disease for up to 10 years after recovery. Taking this into account, we can speculate that COVID-19, there will be an increased risk of heart disease for a few years following the coronavirus infection. Number 2, survivors from the SARS epidemic of 2002 had abnormalities in the lipids more than 12 years after recovery. Number 3, on a positive side, patients who have had heart involvement in the H7N9 influenza infection had returned to normal heart function at follow-up in 1 year. Considering all the information I mentioned so far, it is possible that there will be an increased incidence of long-term residual heart damage following the coronavirus COVID-19 infection. Key points. The commonest heart complication of COVID-19 coronavirus infection is heart failure and inflammation of the muscle of the heart, medically known as myocarditis. Patients with heart injury secondary to the coronavirus infection are at an increased risk of death. Due to the stress during the pandemic, patients can get heart failure without being infected with the virus. This is known as the broken heart syndrome, also known as Takotsubo syndrome. The heart usually recovers well on its own within a short period. At this time, we are not sure about the long-term effects on the heart, as we are dealing with a new virus. But it is possible that there might be a long-lasting damage to the heart after recovery from the coronavirus infection.